This is April Van Buchen, and I'd like to cover the concept of safety with everyone. Safety is one of the concepts you will learn throughout this program. The umbrella of the concept of safety covers the following exemplars: fall prevention and restraints, medication administration, care coordination, team systems, and error reporting. There's a couple of definitions. I'll give you time to read them in case you don't know how to define safety or safe care. You'll hear that a lot in healthcare. Safe care, avoiding injuries. The concept of safety has some attributes that involve knowledge, skills, and attitudes of the nurse. You see, for knowledge, there has to be a focus on safety in order to execute the skills. For knowledge, you have to know how to safely use technology, for example. For skills, the nurse needs to understand the tools that contribute to a safe system. You must know how to insert that catheter, insert that IV, or move the patient. You need to know the skills. There's a lot of safety components to that. And finally, but not least important in any way, as I hope you learn from NSG 130, the attitude of the nursing professional is vital. Nurses and other healthcare professionals need to value their role in safety and collaboration. There are so many human factors involved in establishing and maintaining a safe environment. There's technology. There's relationships between people and the work environment. If you think about the ability to perform a task while thinking about all the 50 other things that you have to do, you might forget something that impacts the safety of the patient. You might skip a step because you're rushing, and that impacts the safety of a patient. So the ability or inability to perform a task when you're multitasking is huge when it comes to healthcare and safe patient care. The work of a nurse is very complex. They must be organized. They must prioritize safety for everything that they do. And they must support other health professionals in eliminating hazards. Or what are hazards? It's an unsafe environment. When I know you're just learning about the concepts that you're going to cover throughout this program, but there are other concepts that safety is related to. Healthcare quality. So the quality of your care, safety impacts, right? If you don't have a safe environment, your quality is not going to be good, right? Collaboration. Collaboration means working with others. Do you play well with others? Nursing is a team sport. Nurses must play well with others. They must be able to collaborate with other nurses, with other departments, with physicians, with nursing assistants, with dietary. They must do that in order to maintain a safe environment for their patient. Communication. Some people think communication and collaboration are one and the same. They're very closely related, but they are different, and you'll learn that throughout this program. But you must be able to communicate to provide safe care. And definitely care coordination. You must know how to delegate and be delegated to. You must know how to coordinate care to provide that patient with the care that they need. There are lots of types of errors that happen in healthcare. There's an adverse event, which is something that happened because I forgot something. Because I did something I shouldn't have. So I could have forgotten or did something I shouldn't have. And it doesn't matter if there was no injury. If I did something I shouldn't have or I forgot something, that's an adverse event. There's a near miss. Man, it could have harmed that patient, but it didn't. That's a near miss. There's a sentinel event, which is bad news. A sentinel event means I had serious injury or death to my patient because of an error. And we have a lot of those in this country. And there are agencies that regulate us, watch us, and track those things. Finally, a few words on what a high reliability organization is. A high reliability organization such as Valley Health will frequently use a term called culture of safety. A culture is a common sense of beliefs and attitudes that are shared amongst a group. So the employees of high reliability organizations share the value of safety. That is the common theme, and therefore they have a culture that's devoted to safety, or a culture of safety. Healthcare organizations value reporting errors without punishment. In the old days of healthcare, punishment happened. If somebody screwed up, gave the wrong med, they got written up, they got in trouble, they got fired. So people were very reluctant to report errors. Now we have a shift in reporting because we strongly believe, and there's a great deal of evidence out there that has proven that if you encourage people to report their mistakes, report their errors, and help you figure out why it happened so that other people don't make those errors, or so that you can fix the problem before it gets worse, you will improve the culture of safety of your organization. And this is being seen true everywhere. It's especially being seen in high reliability organizations. So their focus is predicting and preventing errors. They want to learn from their mistakes so that they can prevent. And it's called a just culture. And it's pretty cool. I hope that you appreciate the importance of safety, because in nursing it's at the forefront of everything that you do. Thank you.